Welcome to the deep dive. Today we're taking a closer look at hyperbaric oxygen therapy, or HBO.
Right.
For those of you maybe not familiar, it's basically breathing pure oxygen in a pressurized room or chamber. Think, maybe like scuba diving, but dry.
That's a good way to put it.
Our mission today in this deep dive is to sift through a collection of research. We want to figure out where HBO might actually help with various neurological disorders.
Yeah, sorting the promising stuff from where the evidence just, well, isn't there yet.
Exactly. We're looking at everything from headaches to some really complex conditions mentioned in our sources. So let's dive right in.
Absolutely. We've got some fascinating studies here. Let's kick things off with benign intracranial hypertension, BIH.
Okay, BIH, what is that exactly?
It's basically when you have prolonged high pressure inside your skull, but without some of the other signs you might expect, like enlarged brain ventricles or major issues with consciousness.
So what do people experience?
The typical symptoms are things like persistent headaches, maybe double vision, sometimes vision impairment. And interestingly, it tends to affect obese women of childbearing age more often.
Okay, so pressure inside the head. What's actually causing that pressure to go up? Any ideas?
Well, the exact cause isn't perfectly understood,
Yeah.
but the sources suggest a few possibilities.
Like what?
Could be too much cerebrospinal fluid, the CSF, being produced.
All right.
Or maybe increased pressure in the brain's veins.
Or maybe the fluid isn't draining properly.
Right, decreased CSF absorption.
Yeah.
Or even the brain volume itself increasing, maybe due to extra blood or fluid in the tissue. There's actually some evidence pointing to cerebral edema, brain swelling.
Got it. So if someone has this high pressure, what do doctors usually do? What are the standard treatments?
Standard approaches can range from things like repeated lumbar punctures, spinal taps to draw off fluid,
Okay.
to medications. Dehydrating agents like mannitol, diuretics, sometimes corticosteroids.
And surgery.
In some cases, yes. Ventricular peritoneal shunts can redirect the CSF, but the small ventricles in BIH can make that tricky. For vision specifically, optic nerve sheath fenestration is often preferred. It relieves pressure right on the optic nerve.
All right. So where does HBO fit into this? Our sources mention a study, Luongo et al., from 92.
Yes, that study involved 8 BIH patients. They were treated with HBO, 2 atmospheres absolute daily for 15 days.
2 atmospheres, so double normal air pressure.
Exactly. And breathing pure oxygen at that pressure. The findings were pretty interesting. They saw a gradual disappearance of symptoms in all 8 patients.
That sounds quite positive.
It does, but there was a significant but.
What was it?
The pressure tended to climb back up once the HBO therapy stopped.
So not a lasting fix.
Apparently not. The researchers suggested it might work by maybe reducing CSF production temporarily, or through its anti-edema effect, reducing that brain swelling.
So it tackled the symptoms, the pressure, but maybe not the root cause.
That seems to be the takeaway. It acted like a temporary release valve, as you said earlier.
What happened after that study? Did others follow up on HBO for BIH?
Well, that's the thing. Our source points out that, surprisingly, there haven't really been any subsequent publications on this since '92.
Really? That's strange.
It is. It really highlights that we need more, up-to-date research to see if there's truly a role for HBO here.
Definitely a gap there. Okay, let's pivot now. How about peripheral neuropathy? Nerves outside the brain and spinal cord.
Right. Peripheral neuropathy is kind of an umbrella term for disorders affecting that whole network of nerves branching out to your body.
And the causes can be pretty varied, right?
Very varied. Infections, toxins, metabolic problems like diabetes, injuries, even some medications can trigger it.
And here, the research on HBO seems a bit more, well, fleshed out. Our sources mention a few different scenarios.
That's right. There's some evidence suggesting potential benefits. For instance, animal studies using a drug called cleoquinol to induce neuropathy.
What did they find?
They found that HBO treatment seemed to reduce the nerve damage compared to the controls.
How? What's the thinking there?
The idea is the extra oxygen might help prevent nerve cells in the spinal root ganglia from dying, maybe even resuscitate some struggling ones, and perhaps speed up the regeneration of the nerve fibers themselves.
Rescuing and regrowing nerves. That's quite something. What about diabetic neuropathy? That's much more common.
Yes, there's a study by Lowe and colleagues from '88 looking at diabetic rats. They found that HBO 2 atmospheres, 2 hours, 5 days a week, for 4 weeks, partially reversed the neuropathy.
Partially reversed it. How?
It seemed to boost the energy metabolism within the nerves. So the nerves weren't just getting more oxygen, they were actually using energy better.
Almost like jump-starting them.
Kind of, yeah. And then there's another older study, Neurological et al., also 88, on polyradiculoneuritis.
Inflammation of the nerve roots.
Exactly. Their experience suggested HBO was highly effective. It seemed to speed up recovery, especially for motor problems and those autonomic trophic issues, things like tissue health regulated by nerves.
Any other benefits?
They also noted they could use lower doses of steroids, and patients had shorter treatment times and hospital stays.
Sounds beneficial. Now, a big issue with neuropathy is often the pain. What about peripheral neuropathic pain? I recall some animal studies mention.
Yes, using a model called chronic constriction injury, or CCI, in rats. Really interesting findings there.
Go on.
A study by Zhao et al. In 2014 suggested HBO had this kind of dual effect.
Dual effect.
Yeah, initially, right after treatment, there was a temporary increase in allodynia, the pain from a light touch. This seemed linked to oxidative stress markers.
Oh, so it made it worse at first?
Temporarily, yes.
Okay.
But with repeated treatments, a longer-lasting anti-pain effect emerged. And this seemed related to inhibiting astrocyte activation. Those are support cells involved in neuroinflammation.
So short-term sensitivity, but long-term relief.
That's what it looked like. Yeah. And then another study by the same group in 2015 looked at when to start HBO.
Did timing matter?
It seemed to, yeah. Starting early, day 1 after injury, gave persistent pain relief and inhibited a pain receptor called P2X4R.
And starting later?
Starting later, around day 11, also gave lasting relief, but seemed to work differently more by inhibiting cell death and reducing nerve damage.
What about in between?
Interestingly, starting around day 6 only produced a transient effect.
Wow. So the timing of when you start the therapy could be really critical for pain.
It certainly suggests that, yes. Very important detail.
Okay, what about neuropathy caused by medications? We touched on that earlier. Any specific studies?
There was a study by Jordan in 1998 looking at HIV patients.
Who often get neuropathy from their meds, right?
Exactly. These patients got HBO 2 hours at 2 atmospheres, twice weekly for 3 months.
And the results?
Quite encouraging, actually. Significant improvement was reported in 17 of the 20 patients who finished the study. Their symptoms, numbness, tingling, lethargy, decreased reflexes, got noticeably better.
That's good news for managing side effects. Let's shift gears slightly. Trigeminal neuralgia, that intense facial pain.
Yes, go it all. Looked at this in 2012. Their findings were pretty striking.
How so?
Just one course of HBO, 10 daily sessions led to rapid, long-lasting pain relief. It was dose-dependent, too.
Meaning more treatment helped more?
It seems so. And patients were able to cut down on their carbamazepine, a common drug for this, and their pain scores improved significantly.
So maybe effective for cranial nerves, too, not just peripheral ones.
That's what it suggests. The researchers thought it might be down to neuroprotection, anti-inflammatory effects, or maybe modulating that altered nerve firing.
Interesting. Okay, widening the scope again. What about a much rarer condition, Sussex syndrome? What exactly is that?
Sussex is rare, characterized by this triad: encephalopathy, brain dysfunction, vision loss, and hearing problems.
And the cause?
It's thought to be a microangiopathy, a disease of the tiny blood vessels in the brain, retina, and inner ear. Mostly affects young women, and it tends to be self-limiting, meaning it usually resolves eventually.
Given it's rare, I imagine the evidence for HBO is mostly case reports.
That's right, not large trials. Our sources mention a few instances.
Like what?
Light et al. Reported a good outcome in a young woman with recurrent vision loss treated with HBO.
Okay.
Miscellaneous et al. Described a case where combining HBO with steroids helped resolve the brain dysfunction and reduce visual issues in a severe case involving psychiatric symptoms in coma.
And another.
Herrero et al. Found that steroids plus HBO seemed to reduce ischemic lesions, areas of poor blood flow, in a similar patient.
So suggestive, but based on individual cases.
Exactly. Can't draw broad conclusions, but it points toward a potential role, maybe as part of a combined treatment approach for Sussex.
Understood. Let's move to something with huge global impact. Cerebral malaria, a really dangerous complication.
Absolute devastating. You see neurological signs, seizures, coma. And even with drugs that kill the malaria parasite, mortality and long-term cognitive problems are still tragically high.
Suggesting it's not just the parasite itself.
Right. It strongly suggests that problems with the brain's blood vessels, cerebrovascular dysfunction, are a major factor.
Has HBO been studied experimentally here?
Yes. Blanco et al. did a study in mice. They infected them with malaria and then treated some with HBO 100% oxygen at 3 atmospheres.
And the outcome?
Pretty significant protection. HBO saved 50% of the infected mice, delayed neurological signs, reduced parasite levels.
Wow, quite a range of effects.
Yes, and it also seemed to reduce inflammation markers, decrease immune cell infiltration into the brain, improve blood-brain barrier function, and prevent hypothermia.
So the potential here is as a supportive therapy.
Exactly. Alongside antimalarials and maybe other neuroprotective drugs, other researchers have also voiced support for HBO as a rational add-on therapy in cerebral malaria.
That's genuinely encouraging. Okay, let's talk about something many people experience. Vascular headaches, like migraines and cluster headaches. Is HBO an option?
Well, these headaches are thought to involve blood vessel dilation in the head. Standard treatments exist, of course, both for acute attacks and prevention.
But HBO is considered sometimes.
Yes, especially for people who don't respond well to standard therapies or can't tolerate them. The rationale is interesting.
Which is?
HBO is a potent vasoconstrictor. It narrows blood vessels, more so than just providing regular oxygen, and it boosts brain oxygenation. So the idea is to counteract that vasodilation.
Makes sense. What does the actual research say? Is it effective?
A systematic review by Bennett et al. In 2015 looked into this.
What did they find?
They found some evidence that HBO might help stop acute migraine attacks in general populations, and also some evidence for normal baric oxygen, just 100% oxygen at normal pressure for cluster headaches.
But?
Well, our source author notes the practical issues. Hyperbaric chambers aren't exactly easy to access quickly when a migraine hits, and they're costly.
True.
So, while more research on HBO might be warranted for treatment-resistant patients, normal pressure oxygen is much cheaper and easier for cluster headaches, even if the evidence isn't super strong. Logistics are a big factor here.
Yeah, that practicality point is key. Okay, shifting to a very different area. Autism spectrum disorder, ASD. There's been interest in various therapies here. What's the thinking behind HBO for ASD?
The rationale comes from findings suggesting reduced blood flow hypoperfusion in certain brain areas in some individuals with ASD.
Areas related to ASD symptoms?
Often, yes. Areas involved in social communication, language, auditory processing. Since HBO increases oxygen delivery, the thought is it might improve function in those underperfused areas.
Has this been tested? I think our sources mentioned studies with different results.
Yes, quite different results, actually. A study in Thailand by Chungpaibul Patana et al. In 2008 reported significant improvement in about 75% of the kids treated.
What kind of treatment did they use?
Relatively low pressure, 1.3 atmospheres. For 10 sessions, they saw improvements in social skills, communication.
Okay, but then another study.
Right, a controlled trial in the U.S. by Jepson et al. In 2011. They found no consistent effects of HBO on the children's behavior.
Huh. That's a big difference. Why?
Well, our source highlights a really crucial point about the Jepson study's methods.
What was it?
They used only 24% oxygen at 1.3 atmospheres for 40 sessions.
And that's not standard HBO.
No. Generally, HBO means breathing near 100% oxygen at increased pressure. So the key insight for you, the listener, is that this study didn't really test hyperbaric oxygen therapy as it's usually defined.
So the negative result might not apply to standard HBO.
Exactly. It just underscores how important it is to use proper protocols in these studies before drawing conclusions. We need well-designed trials here.
A very important distinction. Okay, let's make sure we also cover the other side where research suggests HBO hasn't been found useful. This is just as critical to understand. Let's start with dementia from degenerative disorders like Alzheimer's.
Right. Dementia is that broad decline in cognitive functions. Memory, thinking, social skills, while someone's still conscious.
And while HBO might help with vascular dementia or post-CO poisoning dementia?
Correct, but the current evidence does not support using it for degenerative types like Alzheimer's. If people report improvement, it might be due to underlying vascular issues that are responding.
Was there historical interest in this?
Yes. Actually, going way back, people theorized maybe aging brains didn't get enough oxygen. But a key study by Jacobs et al. In '72 was heavily criticized.
Why? What were the flaws?
Things like not considering that oxygen use is often normal in chronic brain syndrome, poor study design, no randomization, questionable tests, a mixed bag of patients, and even a potentially risky placebo.
Sounds problematic. What about later studies?
Raskin et al. In '78 found no cognitive boost with HBO compared to controls in elderly individuals with impairment. And reviews later on highlighted ongoing issues with study quality, inconsistent patient groups, testing limitations, and the difficulty of doing proper blinded studies.
So the consent.
Evaluations by Schmitz concluded there was really no scientific basis to claim HBO reverses age-related cognitive decline. Its use should be limited to research only, considering the potential risks.
Okay, pretty clear on degenerative dementia then. Let's look at neuromuscular disorders. First, muscular dystrophy.
Muscular dystrophy is inherited diseases causing progressive muscle weakness. Early theories about blood supply issues haven't really held up. It's more about problems within the muscle cells themselves.
Any HBO research?
Not much promising. Hiratani and Kuyama in '74 saw only temporary strength improvement when HBO was combined with IV meds, but not with HBO alone. No long-term difference.
Anything else?
A Russian report from '75 claimed no disease progression over 3 years with combined therapy, including HBO, but the study details are lacking.
So the bottom line.
Basically, no real progress on this front in decades. There's no strong rationale for HBO in muscular dystrophy. Hope lies more in genetics and gene therapy now.
Understood. What about myasthenia gravis, another neuromuscular condition?
Right, that's the autoimmune one where the body attacks nerve-muscle communication points, causing weakness.
Was HBO tried here?
There was a controlled trial by Lee et al. Back in '87. It suggested HBO, alone or with steroids, might lead to better improvement rates than steroids alone.
Did they suggest why?
They noted some signs it might have an immunosuppressive effect based on antibody levels.
But
There hasn't been much follow-up work in the 30-plus years since. That potential immunosuppressive effect isn't proven. So currently, there's no real justification for using HBO routinely for myasthenia gravis.
Okay, that gives us a really good map of conditions where HBO shows some promise, and those where the evidence just isn't there right now. Let's try and bring all together. What are the key takeaways from this deep dive?
So summarizing what we discussed, our look at the research suggests HBO does hold, some real potential for certain neurological conditions.
Which one stood out?
Benign intracranial hypertension showed promise, though clearly more research is vital there. Peripheral neuropathies looked encouraging, including neuropathic pain and drug-induced types.
And others?
Also trigeminal neuralgia and the rare Susac syndrome. And importantly, as a potential supportive therapy for the very serious condition of cerebral malaria.
And on the flip side, where is it not recommended based on current evidence?
The evidence really doesn't support using HBO for degenerative dementias like Alzheimer's disease. The same goes for neuromuscular disorders like muscular dystrophy and myasthenia gravis.
And ASD, autism spectrum disorder.
That's still very much up in the air. The conflicting results really emphasize that we need studies using proper standardized HBO protocols before we can say anything definitive.
It just hammers home how vital it is to have these rigorous, well-designed trials, doesn't it? To really understand the potential and the limitations.
Absolutely, especially in those areas where we see these initial positive signals. That preliminary work is a starting point, but we need robust studies to know how or even if HBO fits into clinical practice for these conditions.
So to leave you, our listener, with something to think about. Based on what we've explored today, which neurological conditions do you think most urgently need more high-quality research into hyperbaric oxygen therapy? And maybe what are the key questions you'd want those future studies to answer? It's a question that really touches on both the hope and the unanswered questions in this field. Thanks for taking this deep dive with us.